Femoral morphology can vary among people. So we're just going to describe a few key features that are different between people. One is the angle of inclination of the femoral neck, femoral version, anteversion, retroversion, and the Q angle. So unfortunately, to learn all the details of the femoral morphology is a lot, and then to add this on makes it more complex, but also more interesting. So let's go. Angle of inclination of the femoral neck. So this is in the frontal plane, right? Frontal or coronal plane. And the axis of the frontal or coronal plane is anterior posterior. So this is normal. I'll change my colors. A normal axis is about 125 degrees. What they call coxa vara is if it's less than 125 degrees, so lower, and coxa valga is if it is greater than 125 degrees. And so what does that mean structurally or functionally rather? So less than 125 degrees, coxa valga, essentially lengthens the limb, right? So you kind of go knock-kneed. So the line traveled from your hip down to your knees is kind of longer. It reduces the effectiveness of the hip abductors because they're too lengthened. So you can go refer to the force length curve, and that affects the force production properties of muscles if they're too lengthened. It does decrease femoral neck stress, but it increases the load on the femoral head. If you are less than 125 degrees, it is called coxa vara. Okay, and coxa vara is basically what people used to call bow-legged. So the line of your limb is a little shortened if you're traveling along it. It reduces the effectiveness of the hip abductors because they're too shortened, and the force length curve, if your muscle is too shortened, it can't generate as much tension or force. And if the muscle's too lengthened, it also can't generate enough tension or force. So both of these excessive inclinations of the femoral neck do affect hip abductor function. It increases the femoral neck stress, coxa vara, and decreases the load on the femoral head. Okay, and now we're going to switch gears and we're looking in the transverse plane or horizontal plane. So we're looking down the leg. So it's a longitudinal axis. And either you can have, you have a typical anteversion, so kind of going from the horizontal plane forward of about 15 degrees. If you're greater than 15 degrees, that is an excessive anteversion. And if you're less than 15 degrees, so it's more posterior, that is retroverted. And at first, you might think these excessive would do something different to your foot, but let's walk through it. Excessive anteversion, so greater than 15 degrees anterior. The anterior head of the femur is uncovered, and the body adapts by internally rotating the hip. So you're pointing your toes in, and that can increase pronation, patellar pain, and increase your lumbar curvature. So this is the normal hip here. And since your femoral head is moving anteriorly and is exposed, your body adapts by immediately rotating that hip and toeing in. So for retroversion, where the femoral head is a little too posterior, the body adapts by moving the toe out or a toe out gait or externally rotating the hip. And this can increase supination of the foot. The final morphology change, which is not really a structural change. It's they're measuring certain things statically, which may or may not affect motion. And there's a lot of debate with the Q angle and what it's actually related to. So again, this is in the frontal plane, right, with the anterior posterior. So let's look at how they measure the Q angle. So we use a few points. You have the ASIS, midpoint of the patella, and the tibial tuberosity. And the Q angle is the angle between ASIS and midpoint of the patella relative to the line going through the tibial tuberosity. That's the static Q angle. They also can measure dynamic Q angle. But again, people are assuming that knee problems in women are because they have a larger Q angle, and that is not confirmed because the problem with measuring something static and assuming that it has something to do with motion and injury is a far leap. So keep investigating if this is of interest to you, because there should be a lot more research coming out.